So with our hemorrhage control, we'll start off with just talking about external hemorrhage first. So once we've done our scene assessment, primary assessment, and we've indicated the need for hemorrhage control, we are going to start there. So we'll just talk about some basic hemorrhage control items. So our first and most obvious one would be if we had a leg with a wound on it. Our first step is just direct pressure. So applying direct pressure directly on that wound, really forcing your fingertips or whatever you can into that wound to apply some direct pressure. With that being said, you can do direct pressure. You can elevate slightly the limb if you need to. You can also use pressure points by blocking off the femoral artery to that affected leg. If that isn't effective, or if you've noticed straight off the bat that it is a arterial bleed and it needs immediate treatment without the use of direct pressure, then we're going to use a tourniquet. So with our tourniquets, what we're going to do is we're going to prepare it and we're going to apply it to the affected limb. We're going to apply it approximately 2 inches above where the wound is. So we're going to apply that tourniquet. We're going to make it nice and tight. You're then going to twist and twist, and you're just going to keep on twisting. If you'll notice, we in Canada have metal devices because in our cold north, it gets very, very cold and these will actually snap and break. So you're tightening it until either the hemorrhage stops or you can't tighten it no more. You're then going to apply this to secure it in place, and you're going to document the time, place, and location of this. If this is not enough to control the hemorrhage appropriately, you will then apply another one proximal to the injury. So if the injury is down here, we're going to apply another one above this here, ensuring that we're not doing it on an actual joint. The other thing that could be a potential is there could be a need for wound packing. So if the area makes it difficult to actually apply a tourniquet, or if the bleeding is significant enough, we will use some wound packing. So I have my wound here. I'm just going to use a little fake hunk of skin here. So what we want to begin with is we're going to start first with burping the wound. So you want to burp the wound and get as much of those blood clots and all that excessive blood completely out of the wound. Once you've finished burping that wound, you're going to take your roller gauze. What I like to do is I like to take out a little bit from the middle and then hold the gauze pad in my hand like this. And all you're going to be doing is pulling the gauze out and stuffing it in the wound. So as you can see here, I'm going to pull it out, stuff it in the wound. Pull it out, stuff it in the wound. We're actually going to be having our fingers in the wound trying to locate the actual source of hemorrhage, and that is where we are directing this gauze. So we're pulling it out, shoving it in there. Pulling it out, shoving it in there. Pulling it out, and we're just going to keep going through this until that wound cavity is nice and packed. Some services do carry hemostatic dressings that actually have hemostatic agents, but we'll just be using gauze rollers for today. So I am going to continue packing that until I can't get any more in there. Keep on going. And we're getting to a point now where I can't fit anything else in there. So what we're going to do here is we're then just going to apply some nice deep pressure into that wound, and we're just going to hold that pressure for a nice good five minutes. After the 5 minutes has passed, we are going to either secure it in place and discontinue or stop right now. The other alternative is that the hemorrhage is not under control and it's continuing to bleed, in which case you would remove all of the wound packing that you just did, and then you would start again. So you would burp the wound, locate the source of hemorrhage, and then begin to pack that wound. All right, so that is wound packing in a nutshell. The other step that I kind of forgot to mention previously is you can also use a pressure dressing for hemorrhage control too. So you can just apply that dressing directly to the wound and then, use that pressure dressing as a form of direct pressure.